special broadcast, a public service announcement from a group of top cardiology students at the University of Guelph. They put together an educational video to showcase a growing health concern. This is Jam's News at 6.
Can I ask you a quick question?
Yeah, sure.
What is congestive heart failure?
I don't remember. I think it's something about your heart filling with liquids. I don't really know.
Perfect. Thank you.
Hi there. Hi. Do you know what congestive heart failure is?
No idea.
Hey, how's it going? Can I have your number?
No.
Right, can you at least tell me the risks of congestive heart failure? Can you guess?
I don't know, smoking or something?
Smoking. Right. Can I have your number again, please?
No.
Are you sure?
Yeah.
Perfect.
To a group.
Sure. I have a quick question for you. Do you guys know what congestive heart failure is? Can you get? You're laughing. Can you guess?
You got too much plaque in your heart and your heart fails. Unfortunately.
Thank you.
Congestive heart failure is a common clinical syndrome where the heart loses its ability to deliver a sufficient amount of blood to the peripheral tissues in order to meet their metabolic demands. There are four syndromes of congestive heart failure. 1. Failure of left ventricle as a pump. 2. Pulmonary venous congestion. 3. Failure of right ventricle as a pump. And 4. Increased systemic pressure. The primary focus of today will be on the onset of congestive failure due to the failure of the left ventricle as a pump. First, we will look at how it is caused by the reduction of myocardial contractility by coronary artery disease. Coronary artery disease is a disease characterized by the buildup of plaques in the artery, also referred to as atherosclerosis. The buildup of plaque in the coronary arteries reduces the diameter, thus leading to a reduction in oxygen and nutrients to the heart, leading to ischemia and manifesting as congestive heart failure. Additionally, congestive heart failure can be caused by cardiomyopathy, either hypertrophic cardiomyopathy, dilated cardiomyopathy, or restrictive cardiomyopathy. Today, we will focus on hypertrophic cardiomyopathy, or HCM. HCM is characterized by the disproportional hypertrophy of the myocardium, typically of the interventricular septum, and to a lesser extent, the left ventricular free wall. This then leads to a reduction in the left ventricular cavity, resulting in an impairment in diastolic function. If the heart is unable to relax properly, it can reduce the ejection of blood, leading to congestive heart failure. Many studies have demonstrated that as the heart begins to fail, there are various compensatory mechanisms that are activated to try and counteract this effect. Some include an increase in the release of catecholamines, causing an increase in heart rate, and activation of the renin-angiotensin system. The kidney has the intrinsic ability to regulate blood pressure. In the case of congestive heart failure, where there is reduced cardiac output, the juxtamedullary cells in the kidney are able to secrete a protein called renin. Renin can convert angiotensinogen to angiotensin 1. Subsequently, angiotensin 1 is converted to angiotensin 2 by angiotensin-converting enzyme. Angiotensin 2 is a potent vasoconstrictor that can increase blood pressure. You may be thinking, wow, this is great. Who needs treatment when my body can repair itself? Well, to a certain extent, this is true. However, this can create an incredibly vicious cycle as the increase in systemic pressure can in turn increase the resistance to the ejection of blood, and thus this can reduce cardiac output even further.
Congestive heart failure is a weakness of the heart that leads up to a buildup of fluid in the lungs and surrounding tissue. We will focus on how the fluid builds up in the lungs due to a weakness of the heart. The right heart is going to pump deoxygenated blood to the lung capillary bed, where it's going to drop the carbon dioxide molecules and is going to receive oxygen molecules. It will then be oxygenated and it will travel through the pulmonary veins towards the left heart. The left heart will then pump the blood to the systemic capillary bed, and the circle will continue onwards. However, if for whatever reason we have a pathological state such as hypertrophic cardiomyopathy or dilated cardiomyopathy, a normal cardiac output, which is around 5 liters per minute, will go down to around, let's say, 1 liter per minute. This means that there's around 4 liters per minute that are not being pumped to the systemic capillary beds. This will cause the blood to stall in the left heart and eventually in the pulmonary veins, and it will stall all the way back and it will back up to the lung capillary bed. This will cause an increase in volume and therefore an increase in pressure in the lung capillary bed, causing the fluid to go from the lung capillary bed to the interstitial space, causing pulmonary edema and also pulmonary hypertension. In order to compensate, the right heart is going to increase contractility in order to counteract the buildup of fluid that occurred from the left heart. This could cause two things. The first one is right ventricular hypertrophy, also called as cor pulmonale, and the second thing is it's going to push blood into the lung capillary bed, which will further increase the volume stress, and it will further increase the pressure gradient, and it will cause more fluid to go into the interstitial space and worsen the pulmonary edema and hypertension.
The risk factors for congestive heart failure include coronary heart disease, which makes up 60% in the United States, valvular heart disease, left ventricle dysfunction, smoking, which consists of 17% of cases in the United States, increased age, being male, high blood pressure, diabetes, a higher BMI, and lower educational levels. Although you can't help aging and being male, there are some preventative measures one can take for the overall improvement in the cardiovascular risk profile. A higher level of physical activity results in weight loss and is associated with a lower risk of CHF by lowering blood pressure, lowering BMI, and decreasing incidence of diabetes. Quitting smoking improves cardiovascular health. An overall healthy weight and a good diet decreases risk of congestive heart failure. Education is also an important factor. A higher education is correlated with the improvement in overall health, including many of these risk factors.
There are many ways to treat heart failure, although if the disease is caught early enough, simple things like changing your diet, getting in more physical activity, and taking medications can improve your symptoms. There are lots of different options for treatment. In diagnosing CHF, a physical exam, electrocardiogram, echocardiogram, and stress test are run. Once a diagnosis has been reached, oral medications can be used. Angiotensin-converting enzyme inhibitors are used to reduce angiotensin II production. In doing this, they decrease vasoconstriction, hypertrophy, apoptosis, fibrosis, and sodium retention. Next, we have beta blockers. These target the beta-adrenergic receptors in the heart. The beta-adrenergic receptors are responsible for stimulating the heart, so by blocking these, we are reducing the cardiac drive, making the heart happy, preventing vasoconstriction, and decreasing the load that the heart has to work against. This medication is great in lowering heart rate and blood pressure. For the last oral medication, we will discuss diuretics. These are two different types, thiazide and loop diuretics. The goal of these medications are to cause the kidneys to remove more salt and water from the body. They're extremely effective in reducing or eliminating some of the symptoms. These should be used in combination with other medications such as ACE inhibitors and not as a monotherapy. For surgical treatments, we have percutaneous coronary intervention, PCI, which is used if the cause of the CHF includes coronary artery disease and uses cardiac catheterization to insert a stent into the artery after angioplasty in order to keep the artery open, improving blood flow. There are also options to include medication in the stent, which release and benefit the patient. Cardiac resynchronization therapy involves implantation of a device such as a pacemaker, which sends timed electrical impulses to the heart, or an implantable defibrillator to correct problems in heart rhythm when they occur. These increase the efficiency of the heart, increase quality of life, and lower mortality risk. Overall, you can see that there are lots of treatment options, and in the long term, these can help to improve the patient's symptoms and condition. In general, CHF does not occur on its own, and it is these comorbidities that make the problem of treating the patient much more difficult.
And that's a wrap on congestive heart failure. Now we head to sports, where Glenn Pyle has just been hired as the new head cardiologist for the Toronto Blue Jays.